Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to talk about Donatella Versace. She is the sister of Gianni Versace, everybody probably knows, a very famous Italian designer. And she has traveled around the world. She's really well known, lots of photographs taken of her and her face. And she's now about 66 years old. So we're gonna take a look at kind of her transition throughout the years and see if we see any signs of plastic surgery and or what she may have done to her face. One thing I think we should mention out of the gate is that somewhere in the early 2000s, Donatella had a lot of turmoil in her life. So, and when those sort of things happen, people tend to want to make some changes. So there was rumors that she had some off-label injection of silicone put in her face. And it sort of was around that time when she was getting divorced and her brother was unfortunately untimely murdered. So, there are some things, again, where patients, they have traumatic things in their lives and they want to change. Divorce is one of the biggest things, but also other things in life can affect kind of their perception of themselves and them wanting to make a change. The other thing I want to note about her history is she's noted to have some bad habits. She's noted to have a history of cocaine abuse and addiction. She's known to be an avid smoker for many, many years, and also a sun worshiper. And unfortunately, those things tend to come back to haunt you later in life. So we'll see if that kind of maybe had some effect on her look throughout the years. So if you look at some photos of Donatella in the late 90s, right, maybe early 2000s, we can see she's in her maybe early 40s, mid 40s, and she's starting to show some signs of aging. And again, like I said, she lived a rather rough lifestyle, so that takes a toll. She was starting to maybe show some fine lines and wrinkles and maybe a little bit tired look to her face. And then we saw, an after picture where she looked a little refreshed. So that's, typical kind of suspicion for things in that age. It would be some Botox, some fillers, skincare, things like that. And I think that's pretty much all I really see. She's always had rather full lips. So I think, she could always be in touch-ups in there, but I think that's pretty natural. But I do see in the mid-face and in her brow and some areas around her eyes that the lines did lessen. So I do think she probably did some Botox and fillers at that time. Then as we progress into the mid 2000s, kind of the late or later 40s for her, again, we're seeing that face hasn't changed dramatically, but it does look a little plumper. And this was also around the time where there was suspicion that she may have injected silicone into her face. And that's possible. It was kind of popular back then to do this off-label use of silicone because a lot of people weren't yet aware of the long-term complications of that silicone, which is forming scar tissue in the face and lumps and bumps and contour deformities. And it's very difficult to remove. So people that did get injected, they kind of had to live with it for the rest of their lives. So I think if she had that injected, she was probably dealing with some of those things. Probably not the complications yet, but maybe the poofiness and a little more fullness in her face that we're seeing, as well as maybe playing with the other things like we talked about, which is Botox and continued fillers. But I don't necessarily see major signs of surgery, or at least yet. Then in the late to mid 2000s, there were some photographs of Donatella after she got out of rehab in Arizona. And I bring it up because there's actual photos of her at that time. And you can see, again, she was obviously tanning. She was much tanner, probably adding to the skin damage that she's acquired over the years. I do notice in the pictures that the nose looks a little more crooked than it did before, which is interesting. I don't think she had a rhinoplasty, but it's possible she could have a little collapse of her nose from the abuse of the cocaine. It's typical that can cause problems with the septum or the support of the nose. And it's possible that it could have caused some problems with that and caused some warping of her nose. And like I always say, when she's getting now into her 50s, she should be showing some signs of aging in her neck and loose skin and jowling. And she's not showing that as much. So again, I'm wondering if at that point she maybe did a little bit of a neck lift, mini facelift, just to set the stage or keep things kind of where they're at so that she's not showing those signs in the lower face of aging. And then the typical things we've talked about already, continued use of those Botox fillers, things like just maintenance sort of things to the face. I do notice that the brow is very smooth and maybe slightly lower. So I don't know if it's necessarily a brow lift now, but definitely, again, suspicious that she's doing Botox in the brow. Then in between the time of probably 2010 to 2015, when she's in her later 50s, we can see some continued signs of aging. In other words, her brow coming down a little bit, the skin, probably some of those bad habits coming back to haunt her skin. We can see some fine lines and wrinkling and things going on in her skin and her face. I do think that her lips are continuing to either stay the same size or even get a little bigger. So I definitely think she's doing fillers in the lips. And I just noticed also that, I don't know if it was the angle of their photos, that the nose looks slightly straighter in these photos. It does look slightly bigger as well. So there's a slight possibility maybe she had some corrective surgery done to that nose if there had been some damage from all that repeated cocaine use. But in general, it doesn't look like it was if it wasn't a rhinoplasty done for aesthetics, and maybe it was done for functional reasons such as breathing or perforation in her septum or something like that. Now we're gonna fast forward a little bit to her early 60s. And there's a photo that surfaced of her which shows her skin looking very porcelain or waxy, and like it's lost a lot of its normal texture. And those, for me, are signs that probably some sort of skin treatment was done. Maybe a deep laser, a deep chemical peel, or multiple deep peels and lasers done to her skin. I don't particularly like that look. It looks very fake or kind of mannequin-like. And its skin kind of loses its normal texture and becomes very shiny. And I do see that in her pictures now, that her skin texture has definitely changed. I also noticed that her hairline, her brow has been raised, which makes me suspicious that maybe a brow lift or something like that was also done in her. And then if I look at her neck, there's some signs, there are some giveaways. We can see some of her submandibular glands, or the glands in her neck's being exposed a little bit. And again, that can be something that happens when a facelift is done. If it's not done properly, or the structures of the neck aren't arranged anatomically correct, you can start to see things hanging in the neck. So I think in this case, I'm suspicious that she had some sort of brow lift, facelift, along with some treatments, pretty aggressive treatments to the skin, probably again related to reversing some of those, the damage that she did early in her life. Now, if we take a look at her current day, she's about 66 years old. There's some recent photos of her. Actually, I think the volume in her face actually is improved. She doesn't look as poofy. She doesn't look as overfilled. But I do notice that the neck looks quite what I would call skeletonized. There's a lot of fat there. You're starting to see some neck banding, some signs, again, possibly that the facelift was done, and some of those results, again, if it really thinned out, that she's got some pulling in neck bands. I think the brow is actually in an okay position. So if they did do a brow lift, I think it's holding up. And I think maybe a slight maintenance with the fillers, but it looks like she's actually backing off of poofing up the face too much. So that's probably a move in the right direction. So overall, I think there's definitely some signs here that she's, dabbled in plastic surgery over the years. And where she goes from here, we have to wait to be seen. I do want to make one comment about her, though. And again, in this photo, I noticed again that her nose looks a little crooked. So maybe she may or may not have done a rhinoplasty. But what I do want to say is that it definitely, at this point, still looks large and bigger. And as we know, as we get older, our noses do continue to enlarge just a little bit because of laxity in the ligaments and maybe a little bit of growth of fatty tissue. Bigger noses are associated with looking older. I think one thing, or one or two things she could do if she really wanted to improve her appearance and also look younger would be to do a rhinoplasty. I'm going to show a picture here of what I think would look good on her as far as if she did a rhinoplasty, because she has a plunging tip, a bulbous tip, a slight hump on the nose, it's crooked. If you reverse all those things, not only would she be more attractive, but she'd also look younger. I think the other thing she could look at is maybe something with the lip distance. She's a very heavy, full upper lip. So combining that rhinoplasty with a lip lift, I think aesthetically for her would make her again look prettier and also a little bit younger. And the last thing would be maybe lowering that hairline, finding if she's pulled that hairline up so far up, maybe some hair grafts or some things to lower that hairline. All of those things would create a younger, more beautiful appearance, but also not a natural appearance. It would be more of a natural kind of youthful rejuvenation rather than something that looks strange or overpulled.
The thing that I think piqued a lot of people's interest in Donatella was this photo of her because of her earlobes. And we'll put that on the screen.
Yeah.
But is that just, I guess, a natural component to aging, or her earrings maybe just too heavy?
I think all of the above, because she's wearing the heavy earrings. But also, if you look closer, it almost like she might have a slight pixie ear there. As we get older, the earlobes continue to grow as well, just like the nose. So as they get bigger and pull down, it makes you look older. So a lot of times we do a facelift to actually reduce the size of the earlobes. But in that case, it looks like she may have weakened that connection and or had a pixie ear that's also pulling down, probably from a prior facelift.
I think it's interesting what you said about her lips, because you are right, her lips have always been pretty full. But there was a lot of speculation that I saw online that she did potentially have silicone injected into her lips. We know in the late 90s, early 2000s, silicone was definitely a thing. If you were to have had, or if she did have silicone injections back then, what are your options now for correcting that?
For lips?
Lips or anywhere in your face?
Well, the problem with injecting silicone, it was a liquid silicone, so it's injected into the tissue, right? So, and there's nothing that will dissolve it. So you can't, nowadays the modern fillers, you can do hyaluronidase or something, inject it, it'll dissolve the filler. That cannot be dissolved, and that was a major problem with injecting that silicone. And then secondly, it would start to form an inflammatory reaction and form scar tissue and balls of lumps and things in the face. And the problem with that is it would be stuck in between all the tissue. Now, areas like the lips, it's possible to remove it because there isn't a lot of nerves and as many things you need to worry about in that general vicinity, but it can create, dents and lumps, and it's a tricky surgery. So a lot of times you can remove that silicone from the lips by literally having to cut it out. And then probably have to replace it with filler or fat grafting, in order to make the lips appear normal again. And then in the face, we have a big problem. Because in the face, we have some very important structures. We have nerves, we have blood vessels, we have all the muscles. And so when that silicone was injected, it can incorporate around all those sorts of things. And if you try to cut out the silicone and it's near a nerve, you could get nerve damage. So that's the problem a lot of people face that silicone injected into their face, is that they can't get it out because there's no way to dissolve it, and cutting it out is too dangerous.
So you just kind of have to live with it.
You have to live with it.
You made that decision back in the day. Don't get silicone injections.
Yeah, I mean, if it's any area near nerves, it's very, very, very tricky to excise it.